Are you dreaming of becoming a cardiologist? You're in the right place. This respected career path saves lives and heals hearts. Let's simplify how to achieve this goal together. Start your journey in the science stream with biology. This foundational step is essential. Once you complete 12th grade, you'll need to clear the NEET exam. This exam opens the door to an MBBS program, the first major milestone. After obtaining your MBBS, the next phase is pursuing an MD in general medicine. This will deepen your medical knowledge significantly. Finally, specialize further by completing DM in cardiology. Though the steps may seem lengthy, they are crucial for a dedicated heart specialist. So, what does a cardiologist do? A cardiologist diagnoses and treats heart-related conditions. Their expertise includes managing diseases like coronary artery disease and heart attacks. They use diagnostic tools like ECG and echocardiograms, collaborating with cardiac surgeons for major procedures. Cardiologists do not perform surgeries but offer comprehensive patient care. They help guide patients to healthier lifestyles, prescribing medications, and monitoring heart health. Saving lives daily brings immense satisfaction, making this career prestigious. Now, let's explore why so many opt for cardiology. The demand for cardiologists is soaring, especially in India. With rising heart disease rates, specialists are increasingly needed. Additionally, cardiology offers a respected status within healthcare. Salaries in this field are attractive, even for freshers. The job offers a dynamic work life, with new challenges every day. Plus, cardiologists often have opportunities to work internationally after passing necessary licensing exams. To start on this pathway, you must meet specific eligibility criteria. Firstly, choose the science stream with biology, physics, and chemistry. Achieving a minimum of 50% in 12th grade is necessary, with a lower threshold for reserved categories. You also need to be at least 17 years old by December 31st of the admission year. If you plan to study abroad, ensure you are well prepared for entrance exams like the MCAT. Next, let's discuss NEET. Is it mandatory? Yes, NEET is essential if you want the standard route, MBBS and then cardiology specialization. It is the only recognized medical entrance exam across India for medical colleges. Without passing NEET, you cannot enroll in MBBS, the foundational degree necessary for becoming a cardiologist. While there are alternative paramedical courses, they won't qualify you as a cardiologist. Remember, to become a cardiologist surgeon, NEET is a must. If you're considering bypassing NEET, reconsider. No NEET means no MBBS, which ultimately means no cardiologist. As you embark on this journey, remember that every step takes you closer to a fulfilling and prestigious career. Start exploring your options today, and take the first step towards changing lives, including your own. If you're excited about becoming a cardiologist, pursue those studies, prepare for NEET, and follow this roadmap. Your heart's calling may just be around the corner.